Welcome again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you some more about bruxism, and also we have bruxism joined with many different problems with orthodontics. Now, this gentleman we're going to talk about this morning on this, he's got a TMJ problem that was quite serious, and it just bothered his work. He could hardly get this with it. He'd have to take medication for the pain, and this was giving him a real problem. But it's a different kind from the guy that was playing football and would be tied up like this. This guy operated the computers for American Airlines and getting the tickets for all these people all over the country, and it was a very stressful job. So he had a stress problem, and he had a TMJ problem where the stress was helping that. But once we got the dental position where the jaw could come forward out here, he could handle the stress without the pain. So this is something you have to work with people. Men have fewer TMJ problems than women do. We found out about 80% of your TMJ problems were with women, and about 20% was with men. So the things that happen with men sometimes are more serious, but they seem to put up with it better than women do. But let's get started. We won't blame our women for all this stuff. So I'm going to show this guy. I knew him so well, I can't hardly keep from calling him by name here, but he's a very nice guy, and he was in charge of a lot of people that worked on these computers. After we finished his work or we solved his TMJ pain problem and had his teeth restored, he sent other people in his office in to have us work on some other people that had TMJ problems too. Just a very nice guy. And now this is his teeth, and he's got some crowns up here that are made out of porcelain. And this is what I talked about the other one. The porcelain will grind the teeth off. It's like a wet rock. You don't think it has the pores in there and it grinds. It's very, very hard, and it eats away the enamel of the teeth. And his lower jaw, he had this deep bite. See, his lower teeth went way on up in here, and he just chewed and wore the front part of his lower teeth out down to the gum line. But the tooth was just, let me show you, I'll show you about the shape of the teeth. Here, we'll put something up here. His lower front teeth normally would look something like this, come down like this, and they were butting up against the back of these crowns of this upper teeth back in here. I'm drawing this wrong. The teeth were like that, but they rubbed right here, and it wore these teeth off down to the gum line where the gum would come in like this, and these teeth are worn down, and this whole portion right here is gone where these teeth rubbed at. Now you didn't even, I drew this wrong really. His his upper front teeth covered down, and you didn't even see the bottom teeth where he meets them. And these teeth just wore there for over a period of years, and his jaw wanted to come forward, and it just kept rubbing up and down in here, and that was pushing the condyle back here, like this is the fossa, and something like that. The condyle was fitting up in here, but it kept it pushed back in this area where your retrodiscal tissue is, and that was giving trouble. This is where the problem was, back of the joint. So you'll just have to visualize this is a jaw joint, and so both of the joints were having a difficult time with that. And you won't get rid of the problem doing anything up here unless you can move the jaw forward like that. So you open the bite. In other words, we'll push these teeth up and push these down to some extent, and we got space in here, and we recrown those. But when you got the teeth down, then this tooth could move further forward, and that gave room to bring the condyle further forward, and it quit pushing the retrodiscal tissue and messing that up. Now, this thing goes on for years on some people. They won't hurt very much, but some of them hurt. They just get real terrific pain with it. And you've got to do something up in this part of the mouth to correct it. So let's see what we actually did. So we're going to put some stuff in here. We're going to bring this up with these arch wires. You can come up like this and pick these teeth up, and you can start right here. Down here, you bring these teeth down, and this will come. The teeth go down in the front here, and the molars will tend to go up some, and these teeth will go up, and the molars will go down. So we'll give the guy a little more vertical dimension of the face, which is kind of ground down lower, and so you can stand to add to the vertical dimension of the face some in that fashion. So we'll kind of watch this as we go now. Now these teeth back here, everything was touching. He had fillings and all this. But now this is porcelain on the backs of these teeth right here. And this porcelain is like a wet rock, and it ground those teeth down. Now when I show you the lower teeth, you look at this. We had other problems. Now he was crowded, these bicusters were crowded out over here, and these teeth were ground off. This had a sharp edge up here, but it's ground down into the edge of the enamel down against the gum. You didn't see these. I think this is the worst case of grinding the lower anterior teeth that I've ever run into. And we just did everybody that came along, whatever problem they had, we could figure out a way to get around that problem. And that's what I want our people that were there at the American Orthodontic Society to be able to do this for everybody. So your pediatric cases you do, and we've covered orthodontics from the birth, before birth, all the way through to 90 years old people we ran into and did that. So the grinding these teeth off right here, he was just subconsciously grinding the teeth against it. His jaw wanted to be further forward. It was hurting, giving him trouble back here at the back. So what we did, we pushed the upper teeth up and pushed these teeth down, and whatever force you're pushing these down with, you're going to be raising the molars back in the back. But then the guy's chewing on those, but when we first start out, they'll be in the open, and this will increase the vertical dimension of the face from under the nose down here to the chin. We'll get a little bit longer. Unless you put blocks on those. You don't want it to open, you put some blocks on them and keep it from happening. So here is the stuff rigged up that I've explained what we're doing. So you got your regular little arch wire coming in, and there's two arch wires here. You just see one, but the flexible wires doing the rotation and all sorts of stuff like that. And this wire goes up like that and comes over. You bring it down, it starts pulling these teeth up. As it pulls these teeth up, that pushes these teeth down. It'll be exactly the amount of force going down here as is force going up here. But you'll have the guy, these teeth will come in contact and he'll chew against that, and that will keep them from coming up very much. Now the lower intruding wire, that's about an 018 round arch wire like that. It comes way on down here, and you raise this up and hook it here. It's pulling these down, all this up here down, and these will go coming up to some extent. Now, this gets kind of complicated, and I don't want to scare off people that are trying to learn orthodontics and everything, but it's hard to do some of this stuff without really sitting down and figuring out every little movement, how these teeth are going to go. So we've tried to cover all this from A to Z in this. So you can find cases that are just almost anything you can think about in orthodontics. We have over 800 videos now, some of them about 810 or 15. We're still doing this. And so this is happening. These teeth are coming up and these teeth are going down, and we get this opened up completely. Now, as soon as that opens up, the TMJ problem goes away. Now we'll push this down. Now the jaw this goes down, this jaw can come on out this way. We pull these up and it gives room, and it gives room and brings these down. Now you remember a while ago we had two teeth that were pushed out of the arch over here. We didn't take any teeth out from him at all. We just brought this down, and as they come down, they kind of move out like this. And that gives us room for these other teeth to come in. It's really fascinating how this has happened and everything. And then when you get this straightened out, this guy has no TMJ problem. He can actually chew better. You know, when you got a closed bite, you have to chew straight up and down like that. And it's about 4 times more efficient to grind the food than it is to just chew straight into it like that. All right, here we open the bite, and we made him a little deal fit in here so he would rest on that while we were opening the bite up. And now that helps us. It has something for those bottom teeth to come in contact with, and he chews on that. Plus, it's going to move those. It'll help move the teeth. The upper ones up and the lower ones down in the front part of the mouth, and reverse that in the molar part. Now, I'm not advocating somebody here that's just starting to learn orthodontics. If you're a general dentist and they didn't teach you any orthodontics in school, that's a shame. They should at least show you what can be done with orthodontics. They just don't do it. And so if you don't know what can be done, you can't diagnose the case properly in there. To fix the TMJ problem, you gotta fix the way the teeth meet in this. So we have this arch wire, this intruding wire was way down here, pulled it up, and it's just like a mousetrap pushing all this down. It raised these teeth up, and now we've opened this up. But this was completely closed. You didn't even see these teeth. Now you see where the teeth ought to be. Now his regular dentist got excited, really thrilled to death with this, and he comes in and crowns these teeth before I was quite ready to do that, but it worked out. He was a good friend of mine, and he didn't even ask me if I was ready for him to do that, but he went ahead and did it, but we were able to work it out. So this came back one day, all these teeth were crowned down here, and you couldn't even see them when we started out now. And so these are down, these teeth that were crowded out are in place. These are going up, we're still working on that a little bit, and we'll finish the guy up in that position. But he stopped having TMJ problems. So you're treating the joint as you treat the teeth in many of these cases like that. All right, let's see. Now he took these lower teeth and he made crowns with a gold base to them, kind of like we showed on that other case, and put them in down on the bottom, and they closed underneath the thing about like that, and they have an overbite. You got to have an overbite and an overjet so that you can come out here and bite something off without your back teeth touching, and you can chew over here, and these teeth don't touch on this side, and chew this other side, and these teeth don't touch. And that's something you have to finish your case out with that going. Now let's look at this a little bit more. So here we came in and we got the upper teeth down, and we had a little bite plate he bites on. These teeth are all together back in here now, and this is biting up against the little bite plate we've got in here, and on the other side of the mouth the same thing. But we got, you see where the teeth fit in here. Now this will tend to wear that portion, so we really ought to do some crowns there, but you're talking about a lot of money correcting that up, and so we didn't do that. But here's where the teeth meet now. The cuspids come in, the points go down in the back, so that's what we call a class 1 occlusion. And now these teeth are still there. Now, I think he later got some more crowns done in there. I'm not sure on that. But this was 93. Now, you would look at this and say, well, you can't possibly put these teeth in like there, but those teeth are there. I don't think. Let me go back here and see. I don't see one directly right there. But what happened, they're this way, and you pick these up, and you go down with this, and now there's space in here for those teeth to come forward, and we have thicker teeth down here, and these teeth have room right here to come in and fill that up. And there's the bottom. I think we'll show that in one of these pictures here in a minute. Now there's where the intruding arches brought those teeth into that position. Now that you see that tooth crowded out right in here, this surely be good in there. And that tooth is crowded out there. Now we got that down, and now those teeth are in place. See, you put the tooth in here. We'll get this one over here a little bit further, and we line that. And the way we got that was the bottom teeth kind of came down like this, and we opened the bite and brought the upper teeth out. And we still have them covered over one another. Now these are terrible crowns right here, but somebody did some without any shape, and I think he had those replaced. Now here we are in 1995, and we had finished, pretty well finished that one, so we have those teeth. You see how they're lined up real good in here. And that's 95. And I think I have some slides that are a little later. This is, we put a lower arch retainer as well as an upper arch to hold that in place while that kind of settles in. Now this is 98, and the teeth are still there. And we finished it back. He's got a good facial height. And now he's smiling. That's the case we started. And now when he smiles, you see these bottom teeth. his jaw is out here. He has no TMJ problem, and we fixed the TMJ problem by fixing it where the jaw could come forward out here, and we didn't need to put a splint on or anything to hold that. We got it out there and knew it would go away. So this is a marvelous thing about orthodontics. You can go in and move these teeth around and fix the way it comes in contact up here and gives you a problem. You straighten this out and you're not aggravating that retrodiscal tissue, and this pain goes away from that. And that's much better than grinding the teeth off like I've shown in some of the cases. They were like that, and they just went in and ground the teeth off, and that stopped it from hurting. But it's a ridiculous thing that people were not taught orthodontics in dental school. Now, why in the devil don't we teach this, whether they want to do it or not? And if they are talented in it and want to get in it and do it, let them go ahead and do whatever they can do. There's enough orthodontics and adult stuff we will never supply all of it. Now the orthodontic schools are opening up now, and where people can go to the school, and there's one school I think in Florida down there somewhere. It costs the student $125,000 a year to go to school. When they get through 3 years, they've spent almost $500,000 trying to learn orthodontics, and they're doing this now. And hopefully they will teach them how to do this type of orthodontics. There's very little adult orthodontics done like this. They just don't have time, or they don't do it, or else the people teaching in the school don't know how to do it either. That's what gets me. And why we don't teach our students in these university schools how to do the very tough, really bad orthodontics. But there's very little of it taught. There's a lot of good orthodontists right over the country that learn how to do it themselves, and that's the way. And this is a case showing that. This man operates the computers for American Airlines, or did when I made it. And this, as far as I know, his teeth are held up all these years. And there's where, watch this point right here, it'll go down here, and here's where that tooth was, this little space. And when we finish him in, this fits right down in here, and that tooth is popped right into place right here. And we, by moving these around, this is adult orthodontics in some of the toughest things that you run into do it. And the case of the acid reflex is another kind of tough. It's not near as tough as this type of case here. Now you look at the other side of the mouth. This tooth was meeting here. We'll bring this back here, and these teeth will fit back in here, and the lower molars will move out in this direction. They'll be coming in something like this. And this, well, I think it's a little bit wrong there, but let's see. That's 1992. This started the case in 93. And this, I think these models, everything messed up here. This is 93 and this is 92. The models were made at the same time right here, but it's further down the line. Now this is 98 right here. See, and this point right here was way out here, and this was back, so he's moved his jaw forward, and that brings this condyle further forward, and that keeps it off of the retrodiscal tissue, and that's your problem area, and this is the solution right over here. And if you are taught what to do to solve this problem back here, how in the devil are you going to do it properly back here? Some people will grind the teeth off so they can come out, or grind the upper ones off, or messing when this can be done, but it's not being taught today. Very little of it. The dental schools where they taught it, I don't think the people teaching it know how to do some of it themselves. I hate to say that, but it seems like that's what's happening. And most of the people are wanting to put Invisalign stuff and straighten. You couldn't even start to do a case like this with Invisalign. Now, but you can do a lot of things with it. It's just another tool to line up the front teeth and close some spaces and do a few other things back here. But you can't do real tough, comprehensive orthodontics by making these little plastic cups straightening the teeth. So we need to teach people what can be done. And I'm sure a lot of these people using a lot of Invisalign have no foggy idea what needs to be really done with the teeth. And this will hold up. I haven't seen this guy for years now, but his teeth were still hitting right. The last time I saw him, it was longer than this. So there it is in '93. You couldn't even see the teeth. Now there are the teeth. And those teeth were crowded, and now they're not crowded. This is the portion after we straightened up. Here's the lower teeth, the way that we started, and here they are now. And he has no TMJ problem, and the teeth are lined up. And this is what stimulates me doing orthodontics. It is so, he was just a real guy helping. He sent some of the people in his office in to get their teeth worked on like this. He had some better crowns made back in here too, fixing that up. And this is something that is so satisfaction for me to be able to help somebody like that. Sometimes it's just better to help the other person. You get a better charge out of it than something doing for your own self. All right, here's the lower part when we started, and there's the way that we're ground off, and that's a difficult case. Put made easy. This is a wrong thing. It doesn't make it easier either. You got to learn a little bit to be able to do that, but it's a difficult case, and here's a way to do it. And you can do it too if you just get down and really get after it. You can learn how to do it. And that's why I'm here at my age still trying to push this across. And we have an organization now, and we're trying to train. We have some of our teachers are able to do this, and we're hoping that this will be taught all over the world. And that was ground off like that, and I didn't get the other deal here, but these teeth are all lined up, and as you saw earlier. So thank you for watching, and I hope that you'll be able to do this type of orthodontics, but don't start off trying to do it unless, and if you go to an orthodontic school, I don't think those people, they're hunting for people to teach them that, and that's not going to just happen overnight. So some people are going to have to learn adult orthodontics before they can start teaching it to people. Thanks for watching, and I hope you'll join our case and then subscribe to this, and we'll try to keep you up to date as long as I'm able to do it. Thanks again, and I'm going to close out.